Ketamine therapy sounds intense, and in some ways it is, but not in the way I expected. For a long time, I thought of ketamine as something you'd hear about in party scenes or in clickbait headlines. It seemed dangerous, experimental, maybe even reckless. But after years of living with depression, trying medication after medication, therapy after therapy, I started looking into it, and what I found was very different, grounded in science, and for some people, it's been a turning point. So in this video, I'll walk you through what ketamine therapy actually is, what it feels like, and what you should know before deciding if it's right for you. No hype, just the facts and a bit of my own experience. If you're not familiar with ketamine therapy, you're not alone. I wasn't either, not until I was deep into depression and out of options. Like a lot of people, I only knew of ketamine as an anesthetic or something people misused. But in recent years, it's emerged as a serious therapeutic option for mental health. Not just a trend, but a tool backed by research and results. I'm not a doctor, and this is not medical advice. I'm sharing my personal experience, but if you're struggling or have questions about your health, it's always best to talk to a qualified medical professional first. Now, ketamine was first used in the 1960s as a surgical anesthetic. It's still used in ERs today, and by medics because it works quickly and doesn't suppress breathing. But doctors noticed something else. Patients sometimes reported a lift in mood, even years after depression. That opened the door to what we now call ketamine-assisted therapy. In a therapeutic setting, ketamine is given at a sub-anesthetic dose, enough to create a shift in perception without knocking you out. It can be delivered as an IV or nasal spray or lozenge. The setting matters too. You're in a safe, quiet space, often with a clinician present, sometimes using an eye mask or headphones to turn inward. By the time I sat down for my first session, I understood the process on paper, but not how it would feel. I followed the prep instructions, settled into the chair, put on the eye mask, and let the music in my headphones fill the space. Within minutes, the constant chatter in my head finally began to quiet. It wasn't like talk therapy, and it wasn't about numbing out. It was more like stepping outside my own head, seeing my patterns from a comfortable distance. Problems I usually felt buried under looked smaller, like I could actually work with them. The biggest surprise was the sense of safety. Memories and feelings came up, but instead of being pulled under, I could simply notice them. The distance gave me room to breathe, but the session is just the beginning. Afterward, I worked with an integration coach who helped me unpack what came up and connect it to real challenges in daily life. That step turned moments of clarity into progress I could hold on to. Ketamine works differently from typical antidepressants, which usually target serotonin or dopamine. Instead, ketamine acts on a neurotransmitter called glutamate, which is central to learning, memory, and brain plasticity, your brain's ability to form new connections. By increasing glutamate activity and triggering certain brain pathways, ketamine can help create new neural connections that may interrupt stuck thought patterns. Some people describe it as a reset or a pattern break. And it's not just chemistry. The altered state during a ketamine session can give you a new angle on yourself and your experiences without running from reality. The real change happens afterward during integration, when you apply those shifts to everyday life. So the obvious question, is it right for you? Well, ketamine therapy is usually considered when antidepressants or talk therapy just haven't worked. It's most often used for treatment-resistant depression, PTSD, chronic anxiety, or emotional numbness. You need to be stable and willing to participate. It's not passive. Again, I am not a medical professional, and this is not medical advice. I'm just sharing what I've learned from experience and research. If you are considering ketamine therapy or have concerns about your mental health, the best course of action is always to talk to a doctor or a licensed healthcare provider. Ketamine is not suitable for everyone, including people who are pregnant, have unmanaged psychosis or bipolar, or serious cardiovascular issues. Providers screen for these before treatment. Seriously, this is not something you should try on your own. It should be done under trained supervision with medical oversight and a plan for follow-up care and integration. But if you're exploring options, one starting point I found helpful was Better You. They offer clear guidance so you can understand the process, weigh the risks, and see if it makes sense for you. See, I started looking into ketamine therapy, but quickly realized how scattered the information was. It's unfortunate, but every single clinic seemed to have different claims, different protocols, different price structures. I didn't want to gamble with something this important. Better You laid out exactly what the treatment involved, offered resources to help me prepare and integrate the experience, and provided real human support from start to finish. Getting started was simple. I created an account, answered a few mental health questions, and was matched with a licensed clinician for a consultation. Once approved, my medication was shipped to me with clear prep guidance and integration tools. Their platform made it easy to book sessions, message my care team, and access everything in one place. When it came to choose a plan, I went with the transformation package. 9 ketamine sessions, coaching, therapy prep, medication delivery, and app support. It costs $792 total and came with a BrainBox starter kit that genuinely helped me stay grounded. There's also the introduction package, 5 sessions with full clinical support for $500. There's no fine print here. My clinician was kind and sharp, the sessions felt safe, and the shifts I experienced mentally were significant. The app was genuinely useful for journaling, meditation prompts, and tracking progress. As a business, they're not perfect. I've heard some people mention slow customer support at times. Personally, I've never had issues, and overall the structure, tools, and personalized care just made a major impact on me regardless. Along the way, I also looked at MindBloom, which is another big name in this world. It's a good option if you want something quick and medication focused, but BetterYou felt more complete and guided with deeper support. Having a dedicated clinician, one-on-one coaching, and an app that kept me on track made the difference. Look, I did not rush into this. It came after years of trying to feel better and being stuck. For me, ketamine therapy created this shift that I could actually feel and build on. It's not an overnight fix. The work happens in the sessions afterward and in how you carry what you learn in your daily life. But it got me moving again after a long time of feeling stalled. If you're considering BetterYou, there's a link in the description. Most of the products we talk about here have special deals through that link that you won't get going directly to their site. If this video was helpful, feel free to give it a like, subscribe, and share your own experience in the comments, especially if you've been through ketamine therapy yourself. I'd love to hear how it went for you. Thanks for watching, and I'll see you in the next one.